Hello, everyone. This is Doc Holliday. Thank you for tuning in today. Um, Today, I want to just go over some new numbers that I've been able to crunch. First of all, uh, I want to give a shout out to all of the medical workers that have been doing their utmost to keep us safe, to protect us, to help us in battling with the coronavirus. You have my immense gratification. Um, and I truly do love you. The country loves you. Um, and we thank you for being there to help us in dealing with this, in dealing with the coronavirus. So that is first and foremost. I definitely want to thank you, to say a word of thanks to all of the medical providers, healthcare providers that are global throughout the world. Um, because Lord knows if we didn't have the healthcare providers, the world would be in a whole lot worse state than it is right now as it relates to the coronavirus. So that being said, I also would like to provide an update on my predictions as far as when we are going to be seeing 1 million people be affected by the coronavirus. Um, and as of right now, it looks like that won't be until around the July 4th timeframe. So we'll have about 7 months here uh, to actually get to that point. Um, so, whereas where it was around April 1st that I was given it to be um, the 1 million um, death count for the U.S. Um, as medical improvements have came about, there has been some developments, and also we have the vaccines available as well. So we have been receiving a lot of improvements. We've been dealing with this virus right now for about 10 or 11 months now in the U.S. Um, and we are unfortunately going to be dealing with this virus for a long time to come. I am hoping um, that the vaccines are going to prove to be sufficient in fighting the virus. Um, I do have an additional concern about the vaccines. My concern is my last concern is whether or not if a person was to take the vaccine and say, for example, I think the one that's going real well now is the Pfizer. That's the one that a lot of people are getting. If the Pfizer vaccine does not work for some people, would their immune systems or RNA or whatever that is that they're utilizing uh, to fight the COVID vaccine? Um, I am wondering if the people that are not able to um, see any benefit from the Pfizer, if their RNA are going to be available to to accept the new vaccine that the person was to try uh, to take, um, or would their RNA be changed and thus the having an additional vaccine to inoculate the person would that new vaccine had to be completely new and have a different signature point in order for it to be effective, being that the patient has already taken the Pfizer vaccine. So that is the other question that I have. If it proves that for some people the vaccines, the Pfizer vaccine does not prove to be efficient in fighting the virus, could people that, for whatever reasons, the vaccine does not work with, could they then take the new vaccine and have that be effective, being that they have already taken the Pfizer vaccine? So that is a new one that I hope that the FDA was able to answer prior to them giving approval for it a couple of days ago. Um, let's see. Is there anything else that I want to talk about here? Um, no, that's really it. I just wanted to really give an update on my prediction. Uh, like I said, been doing some new number crunches and everything, and I actually had anticipated that there would have been a little bit more deaths going on right now than we are currently having, um, and again, that is thanks and high praise to the medical staff that we have in this country, because I mean, you look at other countries like, for example, Mexico. You look at their situation they have down there, they are at like a 11% death rate for the country of Mexico. So it's a real dire situation down there. Let me just show you here quickly. Um, let's see. I don't know why it's not. Uh, hmm, uh, okay, as you can see, uh, Mexico's numbers are right, sure, and 1.2 million people have caught the virus, and 112,000 people have been killed. So that's almost a 10% death rate that's going on in Mexico right now. So, our prayers and condolences goes out to everyone that is affected down in Mexico. I'm hoping that you all will receive some of the vaccines, and I'm hoping that some of the nursing staff that we have down up in LA will try to make it back down to Mexico to help you guys out, especially those that are originally from Mexico that speak the language. I'm hoping that they are able to, at least the medical personnel, are able to make it back down to their country to help their countrymen because they are in a very dire situation down there in Mexico. I thank God that it hasn't that the virus has not spread as much as it has up here in the states. Um, because if it did, if we had the equivalent numbers, if their numbers were instead of 1.2 million, if they were 16.2 million, there would be literally 1.6 million people that would have perished if the total cases were equivalent for U.S. and Mexico. So thank goodness that is not the case. But um, as it stands right now, they are in a very dire situation, and I hope and pray that international relief organizations are able to take note of this, and they're able to send resources to the besieged nation, because they are in dire straits right now. But as far as for us here in the U.S., I'm sure all of you already know that I am recommending for everyone to utilize a respirator, um, or a face mask that is completely sealed, that it seals off your face and nose from any outside air that is not filtered through the mask. Um, Please make sure that you all practice your best uh, hygiene. This is a time for everyone to be really going above and beyond to make sure that them and everyone in their household stay safe from COVID-19, because it is, for a lot of people, a death sentence. And as more resources become strapped, as more doctors, nurses, and otherwise medical staff were to come down with the disease, the more impactful that we'll find this disease having on our nation. It's unfortunate right now, being that we have a short amount of vaccines available for the U.S., that a lot of the population itself is not going to be inoculated until summertime. So that being said, we are still going to have a large amount of people that are going to be at risk of catching this disease up until the summertime gets here. So that being said, if the numbers still continue to be on the trajectory that they are right now in, um, I may have to change the forecast even that much more, especially being that we still haven't got our numbers fleshed out for the holiday season just yet. And I think that we are going to experience even more of more people coming sick as the holidays and everything continue to roll on, unfortunately. So I hope that that you are not one of those people. I hope that you all are able to abstain from going to your family's house, having a real large get-togethers, to just, hoping that people won't just treat this as any old normal holiday, because this is everything but that. And in order for us to put our best foot forward, and make sure that I am able to see your happy faces on the other side of this year, I would hope that everyone listens to the warnings and stays at home as much as possible, and mask up whenever they do leave their home domiciles. And also remember that the current guidelines from the CDC that says you should use these kind of masks here, do not pay attention to those guidelines. These masks are the absolute minimum protection level for you. You need to have the higher protection, which would be the respirator, half face mask that you will see on other videos that I posted before. That is the preferred way for you to make sure that you do not catch COVID-19 or coronavirus. Is to make sure that you and your family you utilize these respirators, or at the very least, masks that are tightly fitting around your nose and mouth, to make sure that everything that you inhale and exhale actually gets filtered through the mask. Because if you do not have the mask that is form-fitted to your mouth, air supply will come and go through the areas of least resistance. So if you have a mask that is loosely fitting around your face, you will be sucking in air that will be coming from the areas that is loose, where the mask is loose around your face. It will not seek to draw air from through the mask, because that would then prove to be a lot harder than getting the air that is freer, because you have a mask that is not fitting right. So make sure that you and your child and your children are wearing masks, especially you ladies that are smaller, 5 foot ladies and men that are like 5'5" or 5'7" and below, all your 4 feet and 11 people. Make sure that you all are using the proper size mask. If you have kids, make sure that they're using the proper size mask. There's plenty of masks that are available on the market right now. So it should not be any excuse unless you are one of those that are unemployed. And then if you are one of those unemployed, I definitely feel sorry for you. But if you are to continue living, um, um, you know, I want you to make sure that you put the best foot forward, and be able to resist the virus should you come across it. And that is why that I'm recommending that you all upgrade your mask, because I want to make sure that each and every one of you are able to survive this virus should you come across it. And again, the message should not be containing the spread. The message should be making sure that you do not get the virus and doing all you can to prevent yourself from getting the virus. And that means that you are no longer going to just allow yourself to use these. You're going to spend the extra money to buy a more um, a more adequate mask that meets the needs that we are being faced with today. So that being said, I am out of here. If you have any questions or concerns, please do give me a text, or leave a comment below. Um, yeah, that's it for right now. I love you all. Godspeed. See you on the next one. Oh, and remember, keep the faith.